the population of post-COVID, of lung COVID, has changed over time. And I think that one of the most significant changes, the population is more aware of these chronic conditions. And I think that the uncertainties are still there, but the more people are aware, and these are people that perhaps were with symptoms for many, many months, perhaps people that were with symptoms for years by now. But these people now, with information more available and information from centers like our center, the Sinai system, is becoming aware not just only of the symptoms, but also the resources that are there. So we're seeing new patients actually every week at our centers. When we talk about post-COVID conditions and long COVID, the 5 different definitions that you can find out there. Again, now more consensus into using post-COVID conditions. What we now, that talking about like optimal treatment may not be the most appropriate way to think about treatment in general for post-COVID. We do not have a definition. We do not know the pathophysiology of the disease. We don't have biomarkers. So what we can do though is just individualize the care and trying to carefully put programs where patients are adapting to these new chronic conditions that they have as part of their post-COVID. And I think that in this, in our approach, which is just helping adapting to the chronic condition, make proper referrals within the Sinai system. We have a group of different subspecialty providers dedicating their time to post-COVID care, and they have seen hundreds of patients. But one of the most important things when we think it's just adapting to the chronic condition that now is affecting you, and it's modifying and challenging every single aspect of your life. So we try to individualize care, be sure that you're not overexerting yourself, neither physically, emotionally, because we know that if you do so, the symptoms can worsen. There are different approaches. So, I mean, we have, for example, stasis is a group that are looking into breathing, and we breathe 20,000 times a day, and 80% of us do not breathe well. So if we concentrate on that, perhaps some of the symptoms may improve. There's another group that has been working with rheumatological diseases and looking to carefully look into triggers of symptoms. While again, not modifying and providing a treatment in itself, really looking what makes things worse and trying for you to avoid them. And with the help of technology and an app and a personal coach, they have found that they can help some of our patients. And then there's another approach of, there are many people that are trying many medications. We believe that sort of like there's risks involved in trying treatments that have not been proven to work. So different approaches. Again, the most important one, until we find that biomarker, until we have a better understanding of the disease, is helping you to adjust to the concept that now you're chronically ill. Again, sort of like with chronically ill patients nowadays, we know in other diseases that do have treatments that were not present before. So being chronically ill today is not being chronically ill, 10 years ago. So the hope is there. Plenty of research in the Sinai system and other systems within our country that will hopefully provide answers. One of the things that people do not know, and I think that is important to emphasize, that as of July of 2020, long COVID can be considered a disability under the Americans with Disability Act. And I think that reflects the reality of the challenges of many of the people out there affected by this. And again, sort of like this also helps tackling one of the issues, which is dealing with legitimacy. and living with uncertainty. These are just like very difficult items that we are trying to help our patients to deal with. And these legitimacy issues can be both at home, can be at work, so in different settings, and it's very challenging for our patients. And again, sort of like how our society grants permission to be ill if you're in the absence of disease. You know, just this is not something that you look at the person and say, well, the patient has a post-COVID condition. So that creates a different layer of challenges for our patients. I think that our system, our Sinai system, and our clinics, our post-COVID care centers are in tune with these particular needs. And we have the expertise to help patients navigate this process effectively.